Town Talk, the official podcast of Summerville, South Carolina, where we bring you the latest news and incredible guests here in Summerville. And today, I am honored to be joined by Stephen Chandler, who is the CEO of Summerville Medical Center. How are you doing today?
I'm great. I hope you are too.
Yeah, I am. And I'm really excited to have a conversation with you. And I'm really appreciative of you finding time to be able to come to Town Hall and have a conversation with me. So to get started, can you just share a little bit about yourself and what brought you here to Summerville?
Sure. Well, thank you again for the time.
Yeah.
We're really grateful for it. So I'm originally from Louisiana, born and raised.
Oh, yeah? Okay.
And I went to school for political science. I wanted to be an attorney for a majority of my life.
Oh, wow.
And I was ready to click submit on my law school applications. I ended up moving up to Washington, D.C. to move in with my best friend at the time, who was interning at the Department of Defense. And we found another buddy from high school that was also up there. And I was just delaying going to law school for a year and moved up there. I ended up getting a job on Capitol Hill and absolutely fell in love with my job, never clicked submit on my law school applications, and spent a total of 4 years up there. I worked as a senior policy advisor to two different members of Congress, primarily in healthcare policy. So it was up there when the Affordable Care Act was passed, and was up there when the federal regulatory agencies were trying to figure out how to implement the Affordable Care Act, which was a really interesting time. And I love my job. It was such meaningful work, and I can say that to you too, Chris, because I really am passionate about the government work that you guys do for somebody who's done it before as well. Mm-hmm. But now, coming up in August, it'll be 12 years since I got this phone call from my dad. And I had a BlackBerry, which was my personal or my work phone, and then I had a personal iPhone. And I gave my BlackBerry number to my family in case of emergencies. Mm-hmm. And I got a phone call from my dad. I was sitting in a meeting, walked out and said, "Hey, Dad, what's up?" And he said, "I just talked to the surgeon that's operating on your mom. They don't think that she's going to make it off the operating room table." And being a mama's boy from Louisiana, I rushed back home. My mom made it off the operating room table, but she never made it out of the hospital. And when she passed away, I needed my dad as much as he needed me. So I moved back home to my hometown. My dad is a 40-year respiratory therapist who just recently retired. My first job was cleaning doctors' offices after school to pay for debate tournaments, and worked in registration at this hospital system. It meant so much to my family, and the point being there is that I think hospitals are the coolest places in the world. I absolutely love working in them. I know that this is what I want to do for the rest of my life. Mm-hmm. And I'm really excited to be a part of Summerville Medical Center. The second part of your question was why here?
Yeah.
and for me, I think there's two main points. The first is when I was doing research about the community, mm-hmm. and I looked at some of the history of Summerville Medical Center, starting at 30 years ago, a little over 30 years ago, as a freestanding emergency department, and has grown into the hospital that it is today. I think one of the former mayors here used to describe Summerville Medical Center, or SMC, as special medical care. And the amazing thing about that is it seems as if this community absolutely loves the hospital. They absolutely love it. And what an incredible burden and responsibility to be a part of something that is so meaningful to the community that we live and work in. The second part is HCA is comprised of 188 hospitals throughout the country. And what we call the Charleston market, which would include Summerville, it is a priority market for the company. And we can say the proof is in the pudding there, but the fact that we've invested almost $250 million in this market over the last 7 or 8 years. So I certainly wanted to go to a place that was growing, that the company was willing to invest in, and that was making a meaningful difference for the community that we serve.
That's awesome. And I know you brought up HCA. Can you explain what that is for our community listening?
Yeah, happy to. So HCA is the largest hospital provider in the United States. So we are based in Nashville, Tennessee, but we have 188 hospitals throughout the country, 2,300 sites of care, and that's been a huge benefit to Summerville because of access to resources, but even things like during the pandemic, where if we were surging in our community in Summerville and we needed extra staff, extra ventilators, extra PPE,
Yep.
because we had so many resources throughout the company, our colleagues never went without what they needed in order to take care of patients.
It's amazing.
And that type of support meant that we had better quality outcomes and better morbidity and mortality rates for COVID patients because we learned what to do very quickly and use those best practices to take care of the people that we live and work with.
That's amazing. That's amazing. And I know you touched base about the growth and how Summerville Medical saw a lot of growth within this last decade, right?
Yeah.
Why? Obviously, people are coming into the Tri-County area as a whole, and so naturally it's going to grow. I know you are relatively newer to the CEO role. I think a year?
Almost a year.
Almost a year.
Yeah.
Almost a year. But what was that growth like for Summerville Medical in the last decade? And what are you guys doing to continue to be there for that growth and prepare for the next growth that's coming into the area?
Oh, sure. I would describe it in kind of three different ways. One is healthcare needs to be convenient and accessible for patients. And so part of our strategic intent is based on what our community needs is growing where the community is growing. And so I would fundamentally say from a vision perspective that the hospital over the last 10 years and going into the next 10 years is to bring healthcare closer to home. And we have an ambitious goal for our community that if you live within where we want to build an access point within 5 miles of where everybody lives. So people don't forego receiving care because it's not convenient, because it's not accessible. The second thing is the complexity of care has fundamentally changed. And how challenging it is to get to downtown to receive complex services from MUSC as an example. We needed to grow with our community, and as we grew, we could become more complex, and we could add services like intensive care. We could add more complex surgery performances. We could do more complex deliveries and more complex emergency care. That's so meaningful because people want to stay in the community that they live in,
Of course,
and we want to provide that to the people that live in the greater Summerville area.
Of course. I think when it comes to healthcare, I'm sure I don't have to sell it to you, but healthcare is huge in everyone's mind that lives in our community. No matter who you are, it's always on the top of the list of what kind of healthcare. We all kind of have our choices, where we go, when we're sick or when we need surgery or something along those lines. And we have our family doctors and all that fun stuff that kind of all collab together. But can you talk a little bit about just the challenges of, I guess, for being in as a medical center? What challenges do you guys face on maybe a yearly basis and then a day-to-day basis, especially here in Summerville?
Yeah. Hospitals in general had a really rough time during the pandemic.
Oh, yeah.
And have certainly dealt with some of the consequences associated with that. To put it into perspective, nationally, about 20% of nurses just dropped out of the workforce. Either they were close to retirement and they said, you know what, I'm not going to put myself at risk, because at that time we had no idea how sick COVID could make you and how it was transmitted.
Yeah.
There were lots of folks that just said, I don't want to do that, and I certainly don't blame them for that. The second one is the hospital is one of those places that stayed open. We were never able to close our doors. And the people that work there and the people that work at Summerville Medical Center are extraordinarily proud of that fact. But because we couldn't close our doors, and the how sick those patients were and how complex they were, people decided to leave the acute care nursing workforce and go do other things. Meanwhile, the hospital's busier than ever. And when you lose a lot of your workforce, that creates operational and logistical challenges.
Of course, yeah.
That we have to work through, and that has been a challenge, I think, for every single hospital. I would say that our community, though, is really fortunate with Summerville Medical Center because of the great culture that we have, that we've really rebounded a lot faster than a lot of other hospitals nationally. One, because the community has wrapped their arms around the hospital and said, we believe in you and we're going to support you. But new nurses and experienced nurses want to come and work here. And what I think is really remarkable nowadays is that we have some clinical departments that there's a waiting list to come and work at.
Oh, wow.
And
that's incredible.
Yeah, 2 years ago, we couldn't say that. We were looking, there was lots of contract labor or travel nursing that was happening, and we weren't. We were a part of that, and we absolutely had to be in order to take care of all of the patients. But that's always a challenge as we come with it. The other part is, things are just getting way more expensive. I think everybody in our community knows that cost of food has gone up. I just was at the grocery store last week and saw that eggs were about $8.
It's incredible, isn't it?
A dozen.
Yeah.
But that has been true for the salary increases that have been demanded for people that work in the healthcare workforce. And for supplies that we use to take great care of patients. So we have to balance those things and seem to be doing a pretty good job of it right now. But those are things that we're always working through. Yeah,
and I think one thing I want to touch base on is COVID obviously was something that all hospitals, especially y'all, really struggled through. I mean, it was incredible just seeing the stories. I mean, I remember back in 2020 reading all the articles and just, you're right. If you're close to retirement, why put yourself through that when you could just, I could see all the challenges that you guys have faced. That said, how did in healthcare and at Summerville Medical, how did going through the pandemic really help you guys prepare for what could be in the future? And hopefully nothing, knock on wood, but what could be?
I think it has forced us to think about how do we pivot quickly and respond much faster than what we would have normally done. Yeah. It's allowed us to shore up supplies and the supply chain. Again, one of the great benefits of being a part of HCA is, in addition to receiving supplies from all over the world, we have enough scale to where we have HCA employees that live and work close to the areas that are making all of our supplies.
Oh, that's nice.
So if a pandemic happens again, as an example, or there's another global disaster that we quickly need resources.
Yep.
Well, there's an HCA employee that can just go, 15 minutes down the road to where the factory is being made and say, hey, I need this, and how fast can you get it? Versus having to work through, all these intermediaries in order to accomplish the goal. I think the other thing too is that it brought the healthcare community a lot closer. And I wasn't here, but I've certainly heard stories and saw it myself in other communities. Hospitals who normally see themselves as competitors, they put their sword down and said, we got to get through this together. Yep. So we're going to share information. We're going to share resources. We're going to ultimately come together and get through this, and it made us a lot stronger. So the avenues for us to have communications with various different entities, nursing homes, long-term acute care facilities, other hospitals, ambulatory surgery centers, et cetera, those lines of communications are way more open today than what they ever have been. And I think we have the pandemic, I don't want to say to blame for that, but it's been a benefit to patients. Yeah, I think, there's trial and error, it's like learning on the job, right? I think during that time, no one has been through a pandemic like that. No one. And so we were all learning how to go through life and our roles, and
y'all in healthcare, that was I would say one of the most stressful places to be in the pandemic time, because I mean there was you had questions, you didn't know what was going on, and then people were getting severely sick and people were dying, and it was tragic. Mm-hmm. And so that takes not only strong leadership to guide the healthcare and the hospitals through it, but great employees and nurses and doctors and heroes, right. Really to help everyone get through these trials, right? That brings me to my next point, is talking about staff and talking about the staff at Summerville Medical as a whole. How are you guys doing on staffing? Because, healthcare, we hear a lot that, there's healthcare systems that are filled and then there's others that are struggling. And we're still in that place now where I think there is a rise in jobs. People, you start to go back to jobs, but people are still struggling. Mm-hmm. So how is that going at Summerville Medical? And then also, what is it like being a staff member at Summerville Medical? What if someone is listening and watching and is interested in maybe joining the team, joining the family? Sure. What is something they can look forward to, and what it's like working for y'all? Yeah.
So to the first question, I think this community is very fortunate that Summerville Medical Center is in a much better spot staffing-wise than a lot of other hospitals in the community, but also throughout the country. And it goes to that culture that you just talked about. Mm-hmm. So what can you expect from that? Well, I think there are lots of different things. One is you're going to feel like you're part of a family. That's important. The people that work at Summerville Medical Center, they care so much about the hospital's success, and they care so much about the patients. And we have just such an absolutely dynamite leadership team that I'm humbled by every single day to be a part of, mm-hmm. that do absolutely remarkable things. And we have such wonderful physicians too. I mean, Dr. Susan Kanaka, as an example, was just rated as Charleston's best colorectal surgeon. Wow. Our labor and delivery team was rated the best place to have a baby in all of Charleston. Wow. And there are so many other accolades that the team has, but they've earned it. Mm-hmm. And that's a fun thing to be a part of. One of the other things too that we just recently have started is this mantra that we have called row the boat, or in a more informal fashion, RTB. And the intent behind it, and we have created our own version of it, but essentially, have you ever rowed a boat before? Oh yeah. It's hard. It is. Right? You're sweating in that first 5 minutes. It's tough. You are, and if you're doing it with somebody else, you guys have to be rowing at the same pace. A rhythm. There's got to build that rhythm. Right. And teamwork. Right. Teamwork in the same direction, and with the same level of energy. Yep. And that is it's a great mantra as a uniting force to say, if you work in environmental services and I am a nurse in the operating room, we rely on each other. We're RTBing for the patient. We're RTBing for each other, mm-hmm. and we're RTBing for our community. And that I'm so excited about that cultural dynamic, to where we're doing things that are much bigger than ourselves. And I think the sense of purpose and the pride that the team has continues to grow every single day, because they know that we're in this together, and you're always going to have support. I love that. And I think that leads to a good work environment, but also to the success of the hospital, right? When people are a team and people work together and they rely on each other, and make stronger teams. I always bring up sports on the podcast. I'm a sports guy, but there's no I in team. Teams are better when everyone works together and everyone kind of works off of someone's strengths and weaknesses and figuring that out. And that's something that, as a leader, is something that you have to navigate and figure out from the top down, right? And so I can only imagine the amount of stress that can come with that, but also the amount of rewarding
feeling that you might get from that as well.
Absolutely.
Talking about, the hospital as a whole, I know we touched base on it a little bit, but where to next, right? Like, where's the hospital going? What's kind of y'all's vision for the future of Summerville Medical?
Yeah, it mentioned a little bit earlier, but that an ambitious goal to bring access points to within 5 miles of where everybody lives, knowing that we certainly have the bricks and mortar of Summerville Medical Center in Summerville, but we need to bring other access points, whether that's physician clinics, freestanding emergency departments, ambulatory surgery centers, closer to the patients and into the communities. For the campus specifically, though, we are right at the finish line of a pretty substantial expansion of bed capacity.
That's right.
At Summerville. It's almost a $70 million investment that's going to add medical surgical beds, progressive care beds, and ICU beds to support the growing community and to support the growing complexity in the services that we offer. The other exciting thing that's on the horizon for us is building an actual level 3 NICU. We've had a specialty care nursery for quite some time, but there are a lot of complex deliveries and complex pregnancies that we ultimately have to send somewhere else because statutorily the law says that we can't care for that mom or that baby. And we want to change that because if you were a parent and you have a child that may be staying in the NICU for 100 days because they're sick, and you live in Summerville, traveling somewhere else, whether that be downtown, that could take you an hour and 45 minutes depending on traffic. That's prohibitively challenging for a lot of people that live in our community. So for us to level up the complexity that we offer in that particular service line is so incredibly exciting for the future of the hospital. The other thing, though, outside of kind of bricks and mortar investment is utilization of artificial intelligence and machine learning to operate more efficiently, to give our clinicians more time with the patients so they have to spend less time documenting. We have half a dozen different use cases that we're piloting and utilizing that can meaningfully change how we take care of our community.
Absolutely. I think AI, we've talked about it on this podcast before, and the growth of AI it's changing the world, to be quite frank. And I've read many things about the healthcare system and how AI is helping and all that fun stuff. And I can only imagine what it can do with documentation and everything like that. But from to play devil's advocate a little bit, there's obviously people out there that are fearful of AI and fearful of what that progression technology could bring, especially when it comes to our health, right? Mm-hmm. What are some things that you're just like, all right, well, here's how it's helping, but something we might kind of avoid, right? Because I think when someone listens or hears that, they're like, am I going to have a robot working on me? You know what I mean?
Right.
And so where's the limitations with that?
Yeah, at the end of the day, a clinician has to be involved in someone's care. I think the use cases that we're going to see with artificial intelligence and machine learning in healthcare is to help clinicians spend more time with patients and make them more efficient and improve their decision making. A great example of that's actually already in use throughout the country is radiology exams. Yeah, you can utilize artificial intelligence to see if I'm looking at a CT exam of yours, that is being looked at by artificial intelligence, and in addition to a physician, and they're comparing notes essentially on what do they see, and utilizing artificial intelligence to inform a radiologist or a clinician about this is what we should actually interpret the results to look like. That's just a small example, but
Yeah.
the same thing even with, when you talk about a robot operating on you, we have some really advanced technology at Summerville. We have Da Vinci robots and other types of robotic systems that we use for spine care, and a physician is the one who is controlling it, for sure, and that's extraordinarily important for patients, but they're utilizing systems that make them more efficient and that make them more accurate.
Yeah.
And as a patient, I would absolutely want that, because historically, if you had a certain type of exam, we had to, if it was in your gut, we would have to cut you open and keep you open and do the procedure, and then your recovery from that and the use of pain medications is substantial. Whereas today, with various systems, not only for the spine but for the abdomen or for GYN procedures, they make 3 small incisions and utilize robotic assisted technology to visualize what they're looking at and complete that procedure faster, in a higher quality, and ultimately better outcomes for the patients.
It's incredible.
It's amazing to see what some of our clinicians do at Summerville.
It's incredible, because I mean, at the end of the day, the growth of technology, and the more we learn and the more we build new ways of doing things, our healthcare gets better. It's proven over time. The more technology that comes into play for us humans, the better our healthcare gets, because we're learning, and even if just finding new medicines, right? I was just reading something about AI the other day. I don't know how real it is, so please don't quote me on this. But something about how AI is helping scientists really get real close to some breakthrough, I guess, cures to different things and different diseases out there.
Yeah.
And because it's kind of, like you said, AI has become a tool for a lot of people and not as a replacement. And that's what everyone's fearful of. Is it going to replace my job? Is it going to replace this? Is it going to replace that? What we need to remind ourselves is that it is a tool. To learn it, understand it. Don't push it away. Understand it, and use it as a tool, but never use it as a replacement to something. And I think it's used in so many different ways. But I'm curious to see how AI will be used to, like I was just talking about, help kind of fill in that gap of questions that folks are having on different breakthroughs, right? Because maybe us as humans, we're just even though y'all are some of the smartest folks ever, are still struggling to find that last puzzle piece, right?
Sure.
And maybe AI helps you kind of connect that puzzle piece. If you give it all those other puzzle pieces and it's like, hey, you're missing this puzzle piece, and you're like,
Right.
So that's like, I can see how that can be extremely helpful. Right. Are you seeing stuff like that happening?
Yeah, less so in a hospital setting, but you're absolutely right. And I think AI doesn't necessarily replace cognition.
For sure.
But it absolutely helps and augment decision making. And I think what you were referring to is some of the CRISPR technologies that are advancing gene mutations and gene changes and creating therapy. Like, we're right on the precipice of solving stem cell. Not stem cell, but sickle cell anemia.
Yeah.
How remarkable, and how meaningful is that going to be for lots of patients, and literally changing their DNA structure so that they are not creating cells that are shaped as a sickle cell.
Yeah.
It's absolutely remarkable, some of the things that are happening in that space and in the oncology space. That I really do think will change the future of healthcare, but I think we're going to benefit from it versus be hurt by it.
Now, before I bring this train home, there's 2 topics I want to talk about, because I think it's not every day I get to sit across from a CEO from a medical center, and I think a lot of people will be interested in this conversation. But 2 big fears in life for humans and for people in our community is cancer and heart disease. Obviously, they're 2 of the biggest killers in the world, especially in our country. What are you seeing in both of those realms? And you can kind of touch one and then go to the other. But what are you seeing in those realms? what are some new breakthroughs that you're seeing, something, and then maybe some tips for our community to help in both, avoid different cancers. Obviously, there's different tips and tricks, but like heart disease and all that fun stuff.
Sure. I can probably not offer clinical advice in a meaningful way, given that I have a political science background and an MBA. But I can tell you and opine on some of the things that are happening in the service lines.
Yeah.
And so HCA has an arm of the company called Sarah Cannon Cancer Institute. And they have lots of partnerships that are materially advancing clinical efficacy and clinical research in oncology. And that's protocols, that's treatment therapies, that's advances in treatment. Our sister facility, Trident Medical Center, has got an absolutely remarkable cancer center that is doing some of the most advanced technology-enabled care for cancer patients. And at Summerville, I mentioned Dr. Kanaka, who is the best colorectal surgeon that I have ever seen in terms of her advocacy of patients and the quality of care that she is providing. So I think treatment protocols for cancer are really accelerating, and more cancers you can live with longer, or we can treat, or we can do early diagnosis, like our breast care facilities, as an example of that, are a boutique service for women. And in addition to things like low-dose lung screenings that we offer at all of our locations to help people quickly identify that maybe they have a nodule in their lung that could be cancerous. Wow. So there's lots of things with early detection, and then after we've detected cancer, how do we quickly move you through a treatment protocol that has the highest likelihood of success based on data? It is really exciting. In cardiology, the advancements in cardiac care in our lifetime have been absolutely remarkable. Number one, statins work. The pharmaceuticals that we have for caring for your heart are really incredible. But if you need advancements, oftentimes we used to revert to the most complex and the most interventional procedure to solve your problem, and that was open heart surgery, right? Where we cracked open your chest, we harvested a vein from your leg, and then did a bypass of your arteries. Yeah. Nowadays, we can. There are physicians that can go through your radial artery right here in your arm, go all the way up to your heart, replace that valve that doesn't work, come out, and you go home same day, next day. And it is it's incredible some of the things that clinicians are able to do. So there's lots of other use cases when it comes to cardiac care that we see happening in the healthcare space. But patients are benefiting from that. They're living longer. They're living healthier lives because of it, and they're taking much less risk to get to that ultimate place because we're doing low interventional treatments all the time.
Yeah, and I think you brought up a good point. Is catching it early and being able to. Especially for cancer and heart disease, but catching it early so you can treat it, right? And I think a lot of people, there's that fear. A lot of people Google their symptoms and then they get scared and they think they have something more serious than it's not. But at the same time, it's kind of finding that middle ground, right? It's like really listen to yourself, listen to your body, and understand. All right, maybe something is up, and maybe it's good to come to Summerville Medical to get checked out, right? The one thing like. With heart disease, I think it's for me. My dad actually had 2 heart attacks and a triple bypass back a few years ago, and it was according to the doctor, and this was in Pennsylvania, but this according to the doctor is from smoking cigarettes, right? And over time that just built up to kind of weaken his heart, and so. There's other things out there that can help you, right? And we all hear it all the time. Go work out, go for a walk, get a little active. And Do you have any other like health tips when it comes to, I know you can't give any really clinical advice, but from your experience in healthcare, I'm sure you've seen it, just kind of different things that might be able to help you live a healthier and happier life.
Yeah, and certainly diet and exercise are incredibly important. But to your point, there's one thing to mention about that is how hard it is to. The ultimate thing that I think all of us need to work on is how to change behavior and
habits.
And that's extraordinarily challenging. One of the things I remember, it's a really famous, it's actually a leadership article called "Change or Die" is the name of the article, and the article summarizes this peer-reviewed study that was done at a university where they took actually open heart surgery patients like your dad, and they followed them through their treatment protocol. And a lot of the times, even after you have advanced cardiac interventions like an open heart surgery or a CABG, the lifestyle changes that are necessary in order to continue to improve are really meaningful. And so physicians are literally saying to patients, if you do not change your behavior, your time on earth will be minimized. But yet a vast majority of people did not change their behavior. The point being is that, and certainly within organizations, getting people to change, even when faced with a life or death situation, is extraordinarily challenging. So how do we do that? And how do we do that meaningfully? And certainly we do that together. The article offers lots of suggestions about that being a part of a peer group who's going through the same thing as you is incredibly motivating. So there's various different things that we can do more psychologically.
Accountability
and accountability component. Public shaming, as some people call it. It certainly exists, and it's a motivator. And disincentives as well.
For sure.
Have been known to change people's behavior, but that's a hard thing for organizations to get behind, but certainly a really hard thing for patients.
For sure. And I think it's, to wrap this conversation up, one thing we touched on a lot is the advancement of medical technologies, especially at Summerville Medical, and you're kind of leading the way in advancement. And I wanted to be sure I brought this up in the podcast before we separate. My grandma was actually seen by you guys. She had pancreatic cancer. And when we first found out, she passed away in 2019. But when we first found out, we were given a very short time period. Well, thankful to y'all and the doctors that were dealing and treating her, they found a quote-unquote experimental treatment that was going through trials, and they tried it on my grandma, and she wanted it done, and it extended her life for 5 years.
Wow.
And I know it wasn't a cure, but she was months away, but it was extended to 5 years.
Wow.
That's a lot of memories made in 5 years, and so I just want to personally say thank you, and I appreciate everything that you and your staff and everyone in the medical industry and the healthcare industry do for us, and because you guys are heroes. You guys are, you see a lot of really terrible things, but you also see a lot of exciting things as well, and I appreciate all of that. So thank you.
I'm absolutely humbled by that. And thank you for sharing. Our job is to keep patients safe, and it's to give them and their family members hope.
Yeah.
The reality for us is that if you live in this community, this is your hospital. Yeah. And I would want you to feel that and know that and experience it every time you walk through the doors. And if we ever fall short of that, that's on me. That's my responsibility, and it's a responsibility I take very personally, and of course want to do everything I can to help support patients. Of course, and I'm going to take this podcast a little longer than I wanted to because I have one more question. Yeah. You are a leader. You're CEO. For anyone who is maybe an aspiring leader, or anyone who is a leader listening or watching, what advice do you have for them? Because you deal with it on a day-to-day basis, being a leader for a medical center, a healthcare center.
that's a lot of stress on your shoulders. What advice or tips do you have for folks that maybe are looking to get into a role like you have, or leaders in different industries and organizations?
Sure. First, and more importantly than anything else, find your why. You're going to have really hard days working in a hospital or being a leader, because there's going to be things that are happening that you feel like are entirely out of your control, but you're going to be responsible for.
Yeah.
If you don't have a why that gives you a North Star, a guiding sense of purpose, those challenging times become overwhelming, and you say to yourself, this isn't really for me. But if you have a why, my why of thinking about my mom every time I walk through the doors of the hospital, and there's a picture of me right next to my computer with me and my mom when I was a kid, it is a constant reminder of why I love doing what I do, and how proud I am to be able to do it. The second thing is find some core values that you have that you can disseminate, so that your team is aligned around those values that you have, but they're values that you hold yourself accountable to as well.
That's important.
So that you continue to progress, are kind of the two main things. Of course, I had lots of mentors, and I feel like I stand on the shoulder of giants sometimes in terms of what they did to support me. But learned a lot of things, even if you're thinking about getting into healthcare, and if it's hospital administration and you came from a clinical space, my biggest piece of advice is be comfortable with delayed gratification, because if you're a clinician, you are seeing a patient potentially get better right in front of your eyes, and that is so gratifying. In leading a hospital, there are things that we're working on today that we may not see the benefits of in 3 to 5 years, and be okay with that, with knowing that there's success, but it's in a totally different way than you may have seen it before.
That's powerful. That's powerful. Stephen, I appreciate
Chris,
the time
thank
today.
You so much.
Thank you so much. And for anyone listening and watching, thank you guys for listening in this conversation. I will have a link to Summerville Medical below in the bio. Go check them out. And if you haven't been seen or are looking for care, give them a call. I'm sure they're happy to help. But until next time, thank you so much.